of those things happening is 2 or 3%. So it's pretty low, but it's not out of the realm of possibility by any means. 2 or 3% chance of having that happen. And the risk of the aneurysm rupturing of this size is about
of my size or that size?
Of the size of the aneurysm.
Of
is
mine,
about
that
1
is 6 milli.
Of your aneurysm is about 1% per year. So
what does that mean? That it erupts?
Yeah. So that's less than the risk of the procedure for the first year. 1% risk per year.
After the first year?
It's additive. So over 10 years, it's about 1 to 2% per year. And over 10 years, that means it's about 10 to 20%. So the reason to treat the aneurysm is statistically in the long-term benefit. In the immediate term, it's better to not, the risk of the procedure can actually be higher than the risk of doing nothing. Does that make sense?
Yeah.
You following me on it too?
I am. I think I am. I mean.
So it gets worse with more years, because you say the first year is 1%.
Every year is 1%, and it's additive.
It's additive. So in 10 years,
Be 10%. 10% chance of erupting. Yeah.
If we just say now, and I have to predict whether your aneurysm will rupture in the next 10 years, the best available data that we have would say that's about 10 to 20% chance.
And if you do the stent, that thing with the coils?
Once it's coiled, it's extremely unlikely to rupture. Almost 0% chance.
Okay.
But there's a risk of having something negative happen during the procedure, because the procedure is not without risk. The advantages of clipping an aneurysm surgically versus coiling an aneurysm is that when you clip an aneurysm, it never comes back. Essentially 0% chance of recurrence. If you coil an aneurysm, blood flow through that blood vessel over time can cause those coils to, instead of forming that perfect sphere like they look like, they can do what's called coil compaction. The blood going up against the coils compacts them into a smaller ball than they were when we put them in.
Right.
And you can have a recurrence of your aneurysm with coiling. And so after coiling, you're not completely through with me following you. I need to see you in 6 months for a repeat angiogram to look and see if there's any evidence of recurrence, which is just a test. It's a low-risk test that we use to look at aneurysms. And if you're good in 6 months, then I'll bring you back again 2 years from now, and we'll look again and make sure everything is stable. And then after that, we'll just do MRA scans, which is more non-invasive, until about 5 years out, and then we'll just say you're cured and we don't have to worry about it anymore.
Right. Okay, and then the other one. Okay, show me mine.
You want to see your scan?
Yeah.
Okay.
Yeah. The one we did here, the one over there.
The MRI. I don't have that CTA. The MRI does not show the aneurysm. MRI scans don't look for aneurysms.
But which one did I do in this place instead of the hospital?
MRI.
Here you did the MRI, and it shows the strokes, but it does not show.
Okay.
MRIs are not. MRA is magnetic resonance angiogram, meaning we're looking at blood vessels. That we can see aneurysms on, but we didn't do an MRA here. We just did an MRI scan here.
Which is more detailed.
They give different information. They give completely different information.
Really? And so what information you got out of this one?
I'll show you that.
Okay.